Welcome to the Apply Club Health. My name is Heinrich. I'm part of the organizing team and will moderate the event today. Thanks everybody for joining us. People are still trickling in. But I will give a brief introduction to what the Apply Club Health is all about. We are a platform and a community to discuss how to use an anthropological lens to improve health and healthcare. We see it as a place to learn, to meet, to share both insights, experiences, and opportunities. It's meant for a wide range of audience, from industry practitioners to students and academics and consultants and activists and whoever finds it interesting. The Apply Club Health is part of the Applied Anthropology Network, or AAN, which itself is part of the European Association of Social Anthropologists. From our organizing team here today is Margaret Jäger and Mirko Paschini, who will help out with the chat. Also Gaia Campanelli, Carol Pisuti, and I might have missed somebody who is just joining. But so we are looking forward to this event. Please mute yourself, but preferably leave the camera on. It's usually nicer for the speaker to have some faces and reactions, unless you want your image not to be recorded. The recording will be just about the presentation, not the discussion, and we will share it in a few days once it's ready on the AAN YouTube channel. We will announce that in our LinkedIn group. The speakers told me they will take around 25 minutes. So we will see, which gives us a lot of time for questions and discussions. After the presentation, either raise your hand or put your questions in the chat. We will looking into the chat or at the chat to see what type of questions there are. I'm very happy to introduce Cyril Maury and JulianGopffarth from Stripe Partners London. Stripe Partners is one of the leading ethnography-based consulting firms in Europe, and much more than that, in my opinion. They will talk about a topic today that is actually close to my heart as well. That is how to make results of projects in healthcare stick and turn them into meaningful and patient-centric results. In the much more sophisticated words of our speakers, that reads as from immersion to impact, how to turn patient-centric data to patient-centric decisions within large health organizations. So the talk will be about one of the primary challenges that anthropologists face in the healthcare sector, and that is how to translate the data we collect when we do research and make sure that those are client decisions actually help and go in the right direction. So this presentation will explore ways how to engage clients so that that process might go in the right direction, so to say. And that can be through immersions in the research process. It might be about engaging clients afterwards in the insights process, but also before, basically building on knowledge that already exists. And we will hear about this in this talk. As I mentioned, we have two speakers here. So Maury is a partner at Stripe Partners. He's a seasoned strategy and innovation practitioner, whose expertise centers on helping companies develop new business models to unlock growth opportunities. He has worked in Latin America and the Middle East, so he particularly enjoys untangling the various operational, organizational, and cultural complexities that are inherent in emerging market expansions. And prior to joining Stripe Partners, he worked for Capgemini Invent and Claro Partners, I assume, out of Barcelona. JulianGopffarth is a senior consultant at Stripe Partners. He has worked across several sectors since he joined Stripe Partners, including media, retail, and digital, but most recently has focused on healthcare and leading projects on hemophilia, and early onset Alzheimer's. I assume we will hear a little bit about these today. Prior to working for Stripe Partners, he completed a PhD in political anthropology and worked as researcher for the European Parliament. So I'm very excited, and I will turn over to Julian and Cyril now.
Right, thank you so much, Heinrich. Very nice to meet you all. So as Heinrich mentioned, we've done quite a few healthcare projects through which I also met Heinrich and came across the Apply Club Health. And yes, we're very excited to be here to present some of the key takeaways from our work in healthcare. And we do really hope that these insights are helpful for you as well. And we're also really looking forward to hearing more from your side. What are your experiences? How does that kind of resonate with what we were saying as patient researchers after our presentation? So what we want to look at today is, as Heinrich already said, how you can better achieve to move from your and your collaborators' immersion into the patient realities that you do in your work to real impact, specifically in large healthcare organizations. Or in other words, to just make sure that the patient-centric data that you gather really leads to the patient-centric decisions in these organizations. And just to note as well that we will have an article version of this presentation available soon too. So please do follow us on LinkedIn. Stay tuned if you want to dig a bit deeper into this topic after the presentation. So just trying to move. There we go. So yeah, we want to kick off the session just to give an overview of what we want to do today. So we're going to kick off this session with a short look at patient centricity. I'm sure many of you are familiar with it, but just that we're on the same page, the kind of promise it holds today and the reality that many of us researchers often face when working with patient-centric data. And then we'll walk you through the 3 key challenges that we faced in our work with large healthcare companies and organizations. And then I will then hand over to Cyril, who will look a bit more into the possible strategies to overcome these challenges and finish with a short outlook. So yeah, what is patient centricity and what is the promise it has, right? And how does that actually match up with the reality that many of us face when doing work in this context? So as many of you probably already know, the roots of patient centricity reach back quite a long time, originating in the rise of patient advocacy movements in the 20th century, and really, a main aim of it being to really prioritize patient perspectives and needs in healthcare. And that really gained momentum with a shift towards more evidence-based medicine in the late 1990s. And at least on paper, this helped to slowly move away from, let's say, a purely biomedically oriented healthcare that focuses primarily on the biology of disease and treatment, that is more looking at a clinical perspective on disease diagnosis, treatment, and management, and that also, as a consequence, prioritize standardized treatments and clinical evidence towards what you would call a more patient-centric approach that focuses really on the patient, puts an emphasis on personalized, holistic care journeys that are really tailored around the patient preferences, circumstances, needs, and also a more inclusive decision-making that really makes sure that the patient is included in that as well. And then in this way can also deviate from these more standardized ways of looking at treatments and care journeys. So today it really is central to many pharma companies' public comm strategies. So there is a high output of company publications, and here you can just I just did a quick Google search. There is literally almost all the big pharma companies talk about it. So it really is a buzzword and has been a buzzword for quite a while. But it's true also that beyond this publicity, there has been some change, of course. So some pharma companies have established dedicated departments that incorporate patient perspectives throughout research, development, and commercializations. Others have formed partnership programs that collaborate with patients and patient advocacy groups, and also try to include these patient-centric approaches to clinical trials. So that is a kind of new development that we see. And then, of course, all this is also bolstered with the rise of digital health. So all these applications and wearables that you have that also lead to this more like bottom-up approach, like increasing desire of greater individual patient control and management of personal health. But if you look at the reality, and I think many of you are have experienced that as well, it is not quite quite the way it should be. In short, patient centricity really is a trend, and many companies speak to it. But at core, well, it might have gained some importance in some companies' decision making. At its core, the decision making really remains driven by biomedical views. And the recent success of newly developed treatments and the high demand for them of treatments that weren't really based on patient-centric research, really has strengthened this trend, and key decisions at pharma companies don't really take into account the patients and their point of view, and primarily tend to focus on how to sell these drugs that have already been developed. And even if there is patient-centric data collected at the company level, it's not really guaranteed that the quality and the impact on decision-making is really happening. So first of all, many pharma companies target consultants as the primary customers of the medication. So they tend to overlook the preferences and the needs of the people, the patients who actually have to live with the treatments in the long term. Then you also have many companies that base their patient centricity on data gathered through digital health applications. So this is great because this data really produces granular insights into the patient lived realities at scale, and that wasn't really possible for many years before that. But it's also true that this is good to technologically more adept patients, right, and can overlook the ones that cannot afford these technologies, or just struggle to manage them and deal with them, specifically older populations. And then finally, there are patient research units in most pharma companies. But the problem, and we will dig a bit deeper into that specifically today, the problem is that this patient-centric data does not really have an impact beyond the research team that follow that more patient-centric approach. So yeah, let's have a closer look at these three key challenges that we've come across during our work. So in our experience, there are three challenges that can stand in the way of making sure that you have, first of all, the right quality of patient data, and secondly, also that this data has an impact not only within the patient research teams, but also on a company-wide decision-making level. So first of all, at the most fundamental level, patient data is often gathered or already available in a way that is really fragmented. But unstructured, often sitting in separate teams that claim expertise over these specific types of data. So we have a quite siloed, a range of data available, but it's kind of hard to be aware of it and to make other teams aware of it. Then secondly, even if there is access to this data, and even if this access is structured and people are aware of it, it is often not integrated in a way that is meaningful to other, specifically non-research teams or stakeholders. And that really, can stand in the way of a shared understanding. You have it available, but you just don't, have the same kind of perspective on it. And then finally, the last challenge that we saw in our work as well is that the impact of patient-centric data and insights is often hampered by inefficient organizational structures that can prevent the move from these insights to more actionable decisions at the top level. So let's go through these three challenges one by one. So the first issue is that, as I mentioned before, the availability that you might need to build your own work on is often fragmented and unstructured. So we have identified, just to kind of show you, and I'm sure you came across some elements of this before in your work, to show you how complex it is, we've identified 5 patient data types that frequently coexist within organizations and are often not being looked at comprehensively and collaboratively. So moving from a more macro to a micro individual patient level, there are at the highest level human truths. So that's all the data that can be helpful to define macro trends and capture socio-cultural shifts. So that can be qualitative, just getting a general understanding of a specific generation or patient segment, or also quantitative, such as global surveys to test the findings at scale. And then moving a level closer to the patient is we have contextual data that really describes and looks at the data, at the behaviors and attitudes towards healthcare in general, and contextual factors that influence access, decision making, and also the adoption of treatments. Again, here, you can think of multi-country ethnographic studies to capture this. It can also be quant sentiment analysis. And then you have at the next level experience data. So that's everything that captures the experience during a treatment journey, including all the actors or the ecosystem of actors that patients engage with, and the kind of solutions they employ. And so this, again, you can think of many ways of gathering this, doing ethnographies, for example, in-depth interviews, social listening on patient forums. And then at another level that's closer to the patient, you have user interaction data that really captures all the physical and digital interactions that are specific to, let's say, a solution or a drug or a device or a digital platform. And then finally, the traditional clinical data that can also include information gathered during, patient care or research, can be lab findings and call insights from medical history. So it's just to kind of show this is a very, complex picture of data that often is available in all these companies. But the key of this really is to kind of tell you that, all these different data levels are important to paint a holistic picture of the patient. And the problem is it often just exists somewhere and it's not really accessed or not accessed at the same level across all teams. And so many of this remains untapped, and we think there's a huge potential here to kind of make sure that you draw on this. And if you do patient research, make sure that you look at all this data in a way that helps you build a more complex, more holistic picture of the specific patient segment and the patients you're looking at. So on the next challenge that we saw, like building basically on the first one, is that even if you have this comprehensive and well-structured database that you as a researcher can build on, the key challenge is then to integrate this in a way that is meaningful, not just to you as a patient researcher and maybe your fellow patient researchers, but also to key stakeholders from other teams that are maybe, follow a different methodology, speak a different language. So when this data integration happens, it often happens without including or collaborating with key stakeholders from these other teams from the very beginning. So as a result, the framing of the data, maybe doesn't make sense to them, it doesn't really resonate with them, and that can really undermine the impact across these teams. And then finally, patient researchers often sit in the middle of tensions between different teams when it comes to what kind of data should be gathered and how applicable it is to different teams at different levels of research. So for example, at a horizontal level, there can be conflicting interests between, let's say, patient researchers and then maybe more commercially and medically oriented teams. And as mentioned before, these commercial and medical teams can tend to prioritize the treatment's commercial success amongst HCPs, so doctors, and other care partners and medical staff. So the bias here really is towards that demographic rather than patients. On a vertical level, you can also have a lot of tensions that we experienced in some of our projects. There can be varying research methodologies, there can be frameworks that are different between, let's say, the global level, so globally oriented teams that tend to sit more at the company headquarters, and then locally focused teams that are looking more at specific regions and countries. So just to give an example from past work we did, we worked on a project where there was a conflict between an existing global patient segmentation and then a segmentation that came out of research at the local market level. And so it was kind of difficult to kind of, negotiate between these two levels for both us and also our client. So yeah, those are the kind of three challenges that we faced when we were doing work in the sector. So just handing over to my colleague Cyril, who will now tell you a bit more about like how we think there could be good ways to overcome these challenges.
Thank you, Julian. Perfect. So yeah, we can move on to this slide, and just to reframe in one sentence the challenge as Julian expressed it right now. I would say that if you think of patient centricity as an outcome, an output of the work that we do as researchers, you have two phases to it, right? So the first phase is how well can we develop an understanding of the patient experience, right? And we can invest a lot of time in that. We can try to develop as precise and robust and complete an understanding of the patient experience And we can get close to 100% of that understanding. Of course, we'll never get to 100%, but we can try to get as close as we can. However, this is not the end of that process. Once we have developed that understanding, what we need to ensure is that this understanding is absorbed and acted upon by the other people who are in charge of developing the patient experience, right? Of developing solutions, treatments that will impact positively the health of patients. And perhaps as researchers, because we have that passion for the patients and that passion for understanding, we put a lot of our efforts into getting to as close to 100% as we can, right? However, we don't think so much as how do we translate whatever we know into something which is actionable and actioned by the other people in that chain that eventually will lead to developing these solutions. And so this presentation is a little bit about that second part. How do you ensure that whatever your understanding is, maybe it's 80%, well, there's not that much information loss and action loss between what you tell the other stakeholders and what they actually do. I think it is perhaps the case that the presentation is not showing.
It disappeared suddenly.
Yeah, somebody disabled me from sharing my screen. I don't know what happened.
Really?
It said host disabled participant screen sharing. Yeah.
I didn't even move, but let me see whether I can allow you again. Sorry about that.
Been demoted, Julian.
Yeah, been demoted.
But yeah, I can speak without the slides for now while it's going back. So what this idea is, okay, so as researchers, let's not get too passionate in a sense about this developing understanding. Let's also think of, okay, how can we ensure that these insights are acted upon? And that to some extent is perhaps the harder part of our job. And that leads us to this particular thing, this particular slide, which is incorporate existing data in diverse approaches from the onset. So that's one thing that we can try to do. And there's methods for us to try to do that on the 15th slide, the next slide. This is acting a little bit more on that upstream part of the funnel. This is about ensuring that we do get closer to 100% of the understanding of users. What is one obvious way to do that, which in practice is a little bit more difficult to put in place, is what you want to do is you want to multiply the data points, the types of data that you surface and that you gather in order to get more of a holistic picture of the patient. One added benefit of including these different methods is that you also, in a sense, increase the likelihood that your stakeholders will find it interesting enough so that they act upon this information. Why is that the case? Because the stakeholders, and I'm sure like those of you who worked in the healthcare space, particularly with pharma companies, will have seen, they tend to be a little bit more interested in the insights that directly lead to, let's say, some potential decisions in the commercial side of things, right? Concretely, there's an example here of a project that we've conducted for a pharma company with Julian, where we combined a couple of methods. One method was pure ethnography. So we went and we spent a lot of time in person with people who suffered from hemophilia in France. We gathered incredibly valuable insights doing that. And then we combined that with NLP. So that's the natural language processing, which is basically taking corpuses of text that exist online. It's publicly available text of what patients are saying about their disease, about certain drugs, about certain treatments, right? And then we analyzed all these corpus of data to see what was the sentiment of these patients towards some specific treatments. This type of insight, basically, what are like the points that some patients think are positive or negative about some treatments, including some that are competing with the treatments of the clients who we're working for, is obviously incredibly valuable for our stakeholders because they really see immediately the commercial potential for these insights to be useful, right? Because they say, okay, so if the treatment option A, patients are not happy for it because of this particular reason, this particular characteristics, it means that we can emphasize that our treatment is better than this other treatment on that particular dimension, right? So by combining these types of data, by enriching the data set that you have, the perspective that you have on a particular disease area, then you can ensure that your stakeholders will be more interested. So again, multiply these different lenses, different types of data, and you will ensure a better buy-in from your different stakeholders, which will lead to, in the end, a more patient-centric approach, if you will. So we can move on, and this is like the second type of action that you can take in order to ensure the efficiency of the patient centricity that you want to promote in the organizations. And this one is quite obvious, but what you want to try to do is you want to try to, as much as possible, favor cross-team collaboration, and specifically what we've seen is particularly effective is to try to immerse your stakeholders throughout the research process, right? There's many different ways to do that, and we can see in the next slides. Some of the most basic stuff is, well, try to, from the get-go, have a little bit of a kickoff workshop, so a workshop where you have all your stakeholders. They can, in a sense, align on what their priorities for the projects are. Also, what we've seen in the healthcare space is that these different stakeholders, very diverse in their functions, their skills, their expertise, all have very valuable information and insights about patients, right? So here, a little bit of a thing that we've seen in the past is, do not believe that because you're patient researchers, because you're ethnographers, you hold the truth about what patients feel and their experiences, right? All the other stakeholders of that ecosystem, no matter where they're coming from, they have a little bit of the truth. Ensure that they have the space to talk about that truth and to share that truth with others, and everyone will benefit. Plus, you will get buy-in because they will have had the chance to contribute, which is often something that leads to a lot of goodwill from those particular stakeholders. So start with that workshop. Second thing that you can try to do, and this will be dependent on where you do the research because different countries have different regulations, but as much as possible, try to bring stakeholders in the field with you. It might be the case that some specific types of stakeholders might be able to join, some others, for others, it might be more complicated. For example, in some countries, if your stakeholder is a researcher, then they can join, but if they're in the commercial team, maybe they cannot. In any event, you need to really research this based on the country and do as much as the regulations allow you to do, right? Because this is obvious, but something that we've seen time and time again is that if you take someone, particularly from the commercial team, so someone who is a little bit more remote from the patients, and they actually see from themselves the lives of patients, their reality, that leads to a visceral understanding which will be invaluable at the time of ensuring that these insights, again, translate to specific decisions around products, again, around go-to-market strategies, and so on. So really bring them on. And then, like at the end of the project, is something that we've done time and time again as well, is have a really, if you can, again, a participative workshop session where people react on the insights that you bring. And this way, what you ensure is that you ensure that those insights are discussed in the moment, that if there are objections, you can, in a sense, have a dialectic conversation that allows to move beyond the difficulties that the stakeholders might see and that you haven't seen. But at least you have the chance to talk it through and to see what are the workarounds. If you just create an insights deck and you present it to the stakeholders without that room for interaction, it is very likely that you will not have the same impact as if you would have done that much more participative type of activity. And that leads us to the last thing that you can try to do in order to maximize your impact. And this is probably the most important one of the three. And the idea here is you need, as a researcher, to try to foster a common language and vision amongst the many different stakeholders that exist within the organization. So if we go to the next slide, one way to think of what is the role of a researcher in a healthcare organization or a healthcare context. Well, I think one efficient way, or one useful, at least, metaphor here is to think of yourself as a translator. And so you're a translator that will translate between different types of populations. The first thing that you'll do, of course, is you need to translate between the needs of patients and all the other stakeholders of the organization, right? To some extent, I think what some stakeholders, like some researchers, see themselves as is the advocate for the patients. I think that is true, but that is not enough, right? The second thing that you need to do is you need to ensure that you are a translator between all the different types of stakeholders in the organization. And so, as Julian mentioned, if you work in healthcare, it's much more complex than if you work in other companies. Why? Because you have a complexity of roles. You have people who are on the medical research side of things, right? So they do the clinical trials. and then they kind of disappear to some extent, right? Then you have all the people who have in commercial roles. So it's people who are still, they might be like patient insights, market insights on one hand, and then like there's like the commercial leads on the other hand. The commercial leads are much more interested in the value propositions. They also tend to be more interested in HCPs rather than patients. Very distinct type of people, right? Then you have like the medical experts. So it's people who are not in the clinical trials, but they are here like to ensure that whatever the communication to HCPs and to patients is, it is aligned with what the research has shown a particular product to be. So that's already very complicated. And then you have, again, to Julian's points, all these differences between is someone in a market. So that means, for example, let's say they're in France and what they really care about is the sales in France, or are they at the global level? And is at the global level, what they care a little bit more about usually is, let's say, the coherence of a particular branding strategy or the coherence with the actual values and strategy of the company at the global level, right? So you have all this complexity, and all these people have very different KPIs, very different objectives, and speak very different languages almost, right? And culturally, they're also very distinct. You're at the middle of all this, right? So you as a researcher, what you can try to do is try to ensure that all of these people understand each other to some extent, and have a shared vocabulary, as we call it. Specifically, there's a few things that you can do that are very concrete to try to ensure that alignment, that again is based on something that people share. So these people are distinct. What you need to try to do is to create similarities, commonalities between all these different people. How do you do that? Well, one classic one for anthropologists, shared rituals. So you can try to install some rituals with different frequencies within the companies. So for example, let's say you have a yearly insights retreat, right? Well, that is a ritual. Let's say that whenever a project starts, what you try to enforce is, well, when we have a project, we need to have a first conversation about what is the type of insights that we want to gather from this particular project. What do we know, what we don't know, right? That's another type of ritual. So think of these rituals as something that create commonalities. The second thing is shared artifacts. This is also like a fairly common theme in anthropology. Well, these artifacts, what can they be? Well, for example, it's frameworks. For example, it is a way to think about the research, different types of research artifacts that you have, or research insights. Some are more tactical, some are less tactical. But basically what you need to find here is like to create some documents, some frameworks, usually they are, which allow everyone to speak the same language, to understand the same things within the research scopes, right? Like what is the question, what is the type of data, and so on. And all of this builds into what we call the common language, which is when everyone in the company really means the same thing when they use the same words, right? And what we've seen in the many projects that we've done is that that is definitely not the case. If you manage to enforce that, to create that, well, then like you basically have won, because the researcher, and through the researcher, the patient will be diffused into all the decisions of the company, right? So this is how you can, in a sense, ensure that what you're doing as a researcher is not only developing more information, more knowledge about the patient experience, but translating that information and knowledge into actually concrete actions that do benefit the patients eventually. And yeah, if you combine all these three strategies, basically what you will have is a maximum impact in terms of translating knowledge into concrete actions. And to conclude, and this is really to open up the conversation, as we've seen through this presentation, well, we are very far from companies and from pharmaceutical companies, healthcare companies in general, already having put in place some, let's say, strategies that really put the patient at the center of their decision making. And we can go to the next slide. So these companies are not yet patient-centric. However, there's already a next frontier that we want to hint at and that we want to start to perhaps discuss, is the fact that even once we manage to have really patient-centric healthcare companies, we're only half of the way to what is the most desirable outcome for healthcare companies, which is to be not patient-centric, but person-centric. Because the very term of patient, if you think about it, is already loaded. What are we talking about? We're talking about someone who is already sick to some extent, right? It is a patient. So that is a way of thinking about medicine, which is really a backwards way to think about it, because you want to treat something that already happened, and you're not thinking about that individual in all the entirety of their life as a person, which has some episodes when they are unfortunately sick and some when they're not, right? And what you need to try to do as society and as a healthcare company particularly, really not is to only treat the patients when they're sick, but is to ensure that someone throughout their life has the best possible, the most enjoyable, the less sick in a sense life throughout the years that they have to live. And I think that this is perhaps even like the most important change that we need to push for as you know, researchers and practitioners, is how do you move from a healthcare system which is incentivized to treat people who are already sick to one which is incentivized to maximize the global health of someone throughout their whole life. And that would be the end of the presentation. To Julian's point, I think we have some links to articles and documents that we wrote on a similar topic. We'll share them with you, but that's the end of the actual presentation. So thank you. Exactly, you can subscribe to our newsletter here. It's very modern. If you just scan that code here with a little dinosaur in the middle with your phone, that will take you, I think, to our newsletter. And we also wrote some specific stuff on healthcare. We'll share them with you later. But thank you.